Hello and welcome to India Top Doctors Health Dialogue. We humans started using surgical procedures thousands of years ago in anthropology with human science. The journey from the introduction of surgery using bone needles to today's highly convenient robotic technology and vaccination campaigns for a population of millions has been a tumultuous one. In today's convenient and evolutionary journey in almost every field of anthropology, there are countless doctors who have made human service the basis of life, trying to understand the progress and professional development that has taken place over the past 2 decades. Many doctors have given new encouragement to primary health care through private sector hospitals. Today, our guest is Dr. Jaspreet Singh Grover, who will tell us more about this topic. Dr. Grover is the director at Preet Hospital, Amritsar, and has an experience of 27 years of working in the service of needy people. So let's welcome him.
Hello, good evening, Ji. How are you?
I'm fine, sir. How are you?
Absolutely fine. So, should we start? I'm running short of time actually.
Oh, sure, sir. So welcome to India Top Doctor.
Thank you.
So let's begin, shall we?
Yeah.
Sir, please tell us something about yourself.
Well, I am Dr. Jaspreet Singh Grover. I am from Amritsar and my specialty is surgery. And I am running a hospital by the name of Preet Hospital in Amritsar only for the last 20 years. And I did my MBBS from Government Medical College, Amritsar, then did my post-graduation from the same college. Then I joined government service, but then I felt that I am not doing justice to my profession because I was a very junior doctor over there. So I resigned from the job and started this hospital in 2002. And by God's grace, it's running well. And it's been 20 years now. And no regrets. I think I'm doing fairly well. That's it.
Okay. So what made you realize that you wanted to be a surgeon? Was it a certain moment or a lifelong fascination?
Then I couldn't get it. What did you say?
So I asked what made you realize that you wanted to become a surgeon?
Yeah. What what was the source of inspiration? Yeah.
Yes, sir.
Actually, I was doing this MBBS and then I did my internship. This internship is a rotatory internship, and everybody has to go to every department throughout the year. So I was posted in surgery during my internship, and that was a time when the terrorism was at its peak. So one fine day, a young boy, say about age of 22 years, he came to my emergency and he was having gunshot. And my boss, he was a surgeon, and he immediately shifted the patient to the operation theater. We did the surgery, and the patient recovered very well, and within 15 or 17 days. And there and then I thought that this is a exciting branch, as compared to medicines, gynae, pediatrician, when you have to make some diagnosis. But in this case, the diagnosis is already made. You have to just remove that thing, and that is for permanent. And I found this surgery a quite exciting branch. That's why I opted for it. But when I look back, uh, this is an exciting branch. Then this is a very tough branch as compared to other branches, because somebody's life in your hand. So you have to be 100% perfect, and you have to give 100% result. Moreover, as that things are going on these days, people don't expect any complications from a surgeon. So you have to be on the toes, and you have to give your 100% when you are opting for this branch, especially the surgery one. Yeah.
So during your surgery journey, so during your journey, what was your family's role in this?
Actually, my family is non-medical. My father retired as an engineer. My mother is a housemaker. And then my wife, she's also a non-medical, but she joined me in my hospital, and she is the administrator looking after the administration of my hospital. But now onwards, uh, since both my sons, they are pursuing medicine. My elder one is pursuing MD medicine, and the younger one, he is in final year of MBBS. So I think when this answer is asked to my children, they will be definitely saying that their father is a doctor. But in my case, the only doctor we had was my uncle, my Chachaji. He is a doctor, and he was my inspiration. That's why I opted for this medical life as compared to the other professions. At that when I was in plus two, there were only two professions like engineer or doctor. Today we have got number of opportunities, we have got number of options. But during those periods, there were two doctor or engineer, so I opted for doctor because I had this inspiration from my uncle. Yes.
So, can you tell us the main role of a general surgeon?
Actually, general surgery is a very broad term. General surgery includes a person who can perform any type of surgery, be it abdominal surgery. You must have heard of like gallbladder surgery, appendix, hernias, and then you can have removal of tumors, you can have removal of some cysts. So a general surgeon performs every type of surgery, and actually, general surgeons were since beginning. But with the passage of time, this surgery has transformed into super specialties, and now we have got super specialties in terms of urology, cardiology, and neurosurgery, pediatric surgery. So general surgeon is one who can perform any type of surgery, but when he feels that it's not his domain, that the patient requires some specialized job, then we definitely refer the patient to some super specialist, and then their role starts. So general surgery is, I should say, the first step, the first link between the patient and the doctor.
Doctor, can you tell us about the changes and progress that have been done from old surgery to surgery these days?
This is a nice question. Actually, surgery as a branch has transformed many a miles, because earlier we used to say the bigger the incision and the bigger the surgeon is. Big surgeon gives big incisions. But now it is the other way around. Now we perform surgeries with minimal access surgery, that is called. We prefer endoscopic surgeries. The problem is that in older days we didn't have this much of anesthesia, we didn't have this much of equipment, and the patient had to undergo this open surgeries. But nowadays, with the upcoming in the branch of anesthesia, as well as the people doesn't have time, they want surgery on one day and they want to get discharged next day, and they want to report to the work on the third or fourth day. So this endoscopic laparoscopic surgeries have made this easier. These surgeries are much better than the open surgeries, and in these cases the incision is very small, the trauma to the patient is very small, the morbidity and is very small, less. So the patient goes to the work very early. So what I feel is that with the passage of time, it has really worked out well for the surgeons as well as the patients. So in every field, you go to any field, there is a progress with the passage of time, and so it has happened in surgical line also.
Thank you so much, sir, for the information. As you're running short of time, I will ask just one last question. As a healthcare expert, what would be your guidelines on the upcoming virus that is coming, the third wave of corona? What would be your advice to the people?
Okay, Tanishi, this we are into the third wave. There's no doubt about it, and the number of cases are rising all over India. I should not say all over India; it's all over the world. The cases are rising, and what it has come out that the Omicron, which is the prevalent virus these days, it's not as harmful or as virulent as the Delta was. In a way, we have to live with this virus only. This virus won't go anywhere. We have to live with it. We have to change our lifestyle. We will have to follow the COVID appropriate behavior. We should wear mask. We should maintain this social distancing. Hand hygiene is very important. So this is going to be part of our life. We should accept it. And the one most important point which I must say, and I should request all the public through your channel, that we should go in for immunization. The immunization has worked in this third wave because you see the hospitalization is very less, the mortality rate is very less, and this may be attributed to the effectiveness of the vaccination we got during this second wave. Since last January, our government has done really well to get vaccinated free of cost to all the public. So I think vaccination one should go in for. Now they have also given guidelines for the booster dose. So virus and immunization, and then that will avoid this isolation. So we have to live with it. No answer questions about it. Thank you.
Thank you, sir. Thank you.
Thanks a
We'll
lot.
meet you.
Thank you. Thank you.
Yes, thank you, sir. And thank you so much to our viewers who watched this video today. If you want to book an appointment with Dr. Jaspreet Singh Grover, you can book your appointment by visiting India Top Doctor's website. Thank you for watching us. We will be back with next time with more such videos. Till then, be safe and keep watching India Top Doctor.